Become a subscriber to Wikisana now.
Welcome, dear viewers, to our format today. Natural medicine. Herniated disc. An ever-increasing problem in our society. And the solutions are often, of course, also associated with operations or perhaps also follow-up damage. What would happen if there was an alternative? And that's what I'm going to discuss today with my two experts. Stay tuned. Nice to have you both here. From the BioMed Center Sonnenberg. And we definitely have the topic of intervertebral discs today. You also joined us as an accident surgeon and orthopaedist. And I am very happy, Rolandas, that you are here today. And dear Thomas, we have seen each other more often and also in this constellation. What I find very exciting today is that you really have a solution for herniated discs, where the patient can really save a lot of suffering and follow-up pain. Maybe you would like to start talking about it right now.
At our BioMed Center Sonnenberg in Swellbrunn, Switzerland, we have really built up a branch where we have achieved extremely good results with back pain and joint pain of all kinds. But now it's about the intervertebral discs. The person has an intervertebral disc between each vertebra. It's like a buffer, ensures mobility, ensures elasticity. So there is a buffer. It's actually like a soft rubber band between the vertebrae. And these are wrapped in connective tissue. In the front and in the back or all around the vertebrae there is connective tissue and they stabilize the whole thing. The stiffer, the more acidic or degenerated these connective tissues are, the less the intervertebral disc, which is like a gel bag between the vertebrae, is not stabilized as well anymore. If these connective tissues degenerate, then there is a risk that this intervertebral disc, such a gel bag, will slip out and then press on the nerve, which is relatively large, and this is called discus hernia. But the problem is not only the discus means this membrane, this intervertebral disc, this is not the only problem, but always also the connective tissue. And now comes the next one. Every vertebra has 4 joints, 2 up and 2 down. And the lower one again. So the spine is actually the joint richest organ of the human being. Not only intervertebral discs and vertebrae, but also the small joints. If the intervertebral discs compress more due to aging, then the small joints compress more on each other, and then the human being has back pain, and then they are called spondylosis or spondylitis or osteochondrosis or osteochondritis and so on. These are all the expressions. Now comes the patient. These are often also younger athletes, I don't know what, or occasional athletes. These are the most endangered, who actually have no good condition at all, overloaded. Whoops, the intervertebral discs goes out. It actually slips out between the connective tissue and can press on the nerves. And now the cascade of problems begins, because then these people think they have to go straight to the specialist, to the so-called specialist, because he says, wow, you can see it on the magnetic resonance or on the X-ray, the intervertebral discs presses on the nerve, you have to operate on that right away. That's not exactly true, that's a mechanistic way of thinking. We say we have to slip the intervertebral discs back in, and that works. It works in practically every patient.
Wir müssen die Bandscheibe wieder reinschlüpfen. Und das funktioniert. Das funktioniert in praktisch jedem Patienten.
We have several patients, just briefly, who have been told by neurosurgeons that they have to operate, otherwise they will get a leg paralysis, because the intervertebral disc presses on the nerves of the ischia, and then it breaks. I don't know how many days. That's exactly not true, and that's where he comes in.
Genau, das stimmt nicht. Da kommt dann.
In the program you told me that after years of orthopedic operating experience, that 80 to 90% are actually unnecessary. How would you proceed in school medicine with such an intervertebral disc failure, and why does it make no sense from your point of view?
I was a passionate operator.
Also ich war leidenschaftlicher Operateur.
I passionately operated on the intervertebral discs. That was a lot of fun, especially for me, also for the patients, because they were very quickly out of bed, also with pain reduction, but that was all temporary, because if you already have the intervertebral discs and then the operation afterwards, then the pain comes back, because of the abrasion, as I said before, because then a buffer is already missing. The pressure on the facets becomes much larger and degenerates much faster.
Die Schmerzen wieder. Wegen, wie Thomas schon sagte, wegen Verschleiß. Weil dann fehlt schon ein Puffer. Druck auf die Facetten wird viel, viel größer und degeneriert auch viel, viel schneller. Also,
and then with experience, with PRP experience, with growth factors, therapies.
I would like to get that explained again, what you are talking about right now.
From own blood therapies, which I have started to use in the course, and they have shown enormous success, that I no longer have to operate.
How can I imagine such a therapy? What exactly happens there?
In the past, before the operation, we always tried to reduce the pain with cortisone injections, with anesthetics. To see if you have to operate, if you don't have to operate, but usually after 3 or 4 times, the patient's patience was over, that nothing happens and that the pain comes back, then we always decided to operate. Later I added, I took away cortisone from these injections, and I had exactly the same results as my colleagues with cortisone. Then I was already puzzled, why do we need cortisone? Later I started with plasma, just injecting it. I have seen that the patients have become much faster and healthier.
What is plasma exactly?
We centrifuged blood, the patient's own blood, and separated the plasma with thrombocytes and injected this mixture.
Directly into the spinal column or into the spinal cord? How can I imagine that?
First, we injected near the spinal column. Later I improved the technique, further developed it, so that we also injected into the spinal column. Then we injected not only the plasma, but also the stem cells. But that only works in young patients where the degeneration was not very advanced.
I am just thinking about what happens to the occupational surgeon at the disc, because if we have such opportunities, are there still factors where you say, if you have used this therapy, are there still cases that should be operated? Have you ever experienced something like that?
Of course, there are cases where you should or have to operate, but that is only 10% of all operations that are now carried out.
Aber das ist nur 10% von allen Operationen, die jetzt durchgeführt werden.
These are special cases.
This scaremongering, can a disc even press so hard that a leg could be paralyzed by it?
I have treated several patients with paralyzed legs with plasma with enormous success.
mit enormem Erfolg. Vor kurzem hat eine Patientin
Also paraplegia.
I had a young patient who had a huge disc accident.
Also sie hatte riesigen Bandscheibenvorfall. Also
The disc was full in the spinal canal.
Im Spinalkanal. Also sie hatte Probleme mit Wasserlassen.
She had problems with urination and bowel movements. She should have been operated on, but she refused.
Aber sie hat verweigert.
Then we started to treat her with plasma.
Mit Plasma zu behandeln. Und
She recently sent me a video of her dancing.
wie sie tanzt.
She came out of the clinic very quickly. That was still in Germany at that time, and after a year she sent me a picture where no longer had a disc accident was visible.
Ja, sie hat mir MRT zugeschickt, wo kein Bandscheibenvorfall mehr war. Also
Only through the plasma.
Yes, only through the plasma.
But what exactly is happening in the body?
I can only confirm that. I didn't do it as deliberately as he did, who is now with us in the Sonnenberg Center, but I also had exactly the same cases of people who were pressurized.
Da hatte ich genau gleiche Fälle auch. Leute, bei denen es auf den Nerv gedrückt haben, hatten eine Ischiaticus.
Had a ischiaticus paralysis, for example, of segmental L5S1, because of a disc in the MRI, i.e., in the magnetic resonance, and it was clearly proven that it had to be operated on, and the surgeon even called the husband, that it was not possible for his wife to refuse it, and so on. She was paralyzed. And they came to us at that time. That was a few years ago.
Und das war das dritte Mal schon, dass sie das hatte. Ganz klar nachgewiesen.
Had already had 2 operations, now again on another segment, and we only did that.
Auf einem anderen Segment. Und wir haben nur das gemacht.
Well, not only, but already at that time, and also on the small joints, because the pain does not only come because of the pressure on the nerve, but because the disc is outside, the vertebrae come closer together, and the small vertebral joints are simply overloaded.
Da ist ja dann die Bandscheibe draußen, die Wirbel kommen mehr aufeinander und die kleinen Wirbelgelenke werden schlichtweg überbelastet.
And that hurts so much. And this is also the case with many people with worn disc, i.e., old people, i.e., the old patient who was with you. With such patients, they actually suffer from the small joints, and then we always inject. So I always injected the so-called facet joints. Also earlier with cortisone. Also without cortisone, with these cell extracts, which are also available, and with the platelets concentrates. And that works just as well. That's incredible, and the patient has no longer any problem at all.
Okay, so no cross-section paralysis.
No, not at all. That was better within days, and she did not come back recidivist. No, she does skiing and she's around 60 now.
And the example you just mentioned, the elderly gentleman, we haven't talked about that here yet.
He had spinal canal stenosis. He could no longer walk 100 meters, then stop for a few minutes, then again 100 meters, and then we injected epidural, i.e., between vertebrae, near the spinal cord. And he could walk again.
Yes, he could only accompany his wife. And then I said, well, how is your back doing? Because you couldn't walk anymore. That's such a sturdy man, a burly one. And he doesn't take care of nutrition at all. So such a person. And then I said, but now you are moving well. He only came with his wife.
Dann habe ich gesagt, aber Sie, jetzt bewegen Sie sich aber gut. Der kam nur noch mit seiner Frau. Was ist denn? Ja, ich muss nicht mehr kommen. Das war so.
He was like, it's so good. I don't have any more back pain. He was with you 2 or 3 times.
I only injected once.
Unbelievable. The big difference we can make now, and this is also the case with the shoulder patient, is that he has a targeted ultrasound, like a very targeted one, and then he can see exactly where it is, and then he can control the injection under ultrasound exactly at this place.
die Spritze unter Ultraschallkontrolle genau an dieses Ort. Das habe ich früher nicht gekonnt. Ich habe einfach
In the past, I just injected in the area and then it has spread out. That was already good. But now he can inject it with a small amount to the exact place. That's the genius. And then these growth factors have an effect.
Das ist das Geniale. Und dann wirken dann diese Wachstumsfaktoren.
So now we are doing ultrasound assisted and X-ray assisted in the clinic. So we have X-ray pictures and ultrasound pictures.
Und unter Bändelwande kennen wir die.
What happens with a PDA? We have often experienced this as women, and then you get a PDA at 5 in the morning, then you don't hit the right spot, and later it can also lead to
Adhesions. When I operated on the spine, then you could see every entry point that you had decades ago or years ago. There are adhesions.
Einstichstelle, die vor Jahrzehnten waren oder vor Jahren und die Verklebungen. Also ich habe das sehr gerne.
I like to operate very much. I like to solve very much. That was microsurgical work, and I also saw that in some patients with this PDA injection that the nerves were glued. That means that there is a disease, a tetanus Scott disease, after these PDA injections or orthopedic injections, at that time with cortisone, because cortisone destroys the tissue.
Das heißt, da gibt es eine Krankheit, Tetanus Scott Krankheit, und die macht sehr viele Probleme. Diese PDA-Spitzen oder orthopädischen Spitzen, damals mit Cortison, weil Cortison zerstört die Gewebe.
And also in the knee, during surgery you can see every injection. There are crystals in these places where you were injected, and after the PDA.
Stellen, wo man gespitzt wurde. Und nach der PDA, also
what consequences can arise in this area?
Erfahrungsgemäß, das sind die Schmerzen.
In this area, also in the legs, also with problems with urinating. For example, there are many symptoms.
Zum Beispiel. Da gibt es viele Symptome.
So in theory, after pregnancy, some people really have problems with the urinary tract muscle. Could this also have caused the PDA?
Mit dem Muskel, mit dem Harnwegsmuskel ja Probleme. Könnte sowas auch dann die PDA verursacht haben?
This is a very big topic. What happens at birth and what happens after birth? Because I have many women who start to complain after birth with the cervical spine, with the lumbar spine, because at birth the pelvis becomes wider, the child has to come out. There are also problems with the sacroiliac joint.
Der Becken wird breiter, das Kind muss rauskommen. Es gibt mit Symphyseproblemen, mit Iliosakralgelenken. Und das alles kann diese Symptome auch auslösen.
Das wäre dann auch weitergedacht. Das können ja dann auch, wie heißt es, wenn der Fuß so...
Are these all things that are related to each other?
Yes, that is more of a shoe topic.
Ich sehe die nur beim Sitzen an.
I only wear them when I sit. But okay, so more of the shoes.
Okay, also eher von den Schuhen.
I thought maybe everything is somehow related to each other.
Okay. Gut.
But yes, an exciting topic. If I could I not release this adhesion operatively, but also work with the plasma method there?
I do it with plasma. I do it between vertebrae, epidural. That means at the point where it happened, and then it floods the spinal cord.
An der Stelle, wo das passiert ist, und umflutet den Rückenmark quasi mit.
Would you also recommend this preventively? If you had an examination, some also get such an examination to check whether they have MS or whatever, that you say, okay, preventively, so that no damage, adhesion, can develop at all, then you take such a plasma therapy right afterwards.
I've never tried it. It's an interesting idea.
Yes, well, you can take it as a suggestion.
Ja, gut, ich finde, es sind ja nicht, kriegt nicht jede Frau die Komplikation. Also,
So to do it preventively would be a bit of a
präventiv zu
gag.
machen, wäre schon ein bisschen keck.
Okay, then wait a little longer.
Yes, I think so.
Erfahrung von dem
Experience of the
Arzt,
doctor,
wie das
how he
macht.
does it, that is very important. whether he does it right or only to get damage, so the expertise of the doctor or the experience also plays an important role.
Yes, an exciting topic. It's great that through your own body a regeneration can take place, and through the substance from your body.
Eine Regeneration stattfinden kann. Und durch die Substanz aus deinem Körper.
Everything in the body regenerates constantly, otherwise we would no longer be able to live constantly, all tissues, and if you only stimulate it properly and let the metabolism run to renewal and not to degeneration, you can also have building up effects in old age.
Erneuerung und nicht auf Degeneration laufen lässt, ist eine Ernährungsfrage, dann kann man auch im Alter noch aufbauende Effekte haben.
So arthrosis is not an operation judgment. You can do a lot there.
Da kann man ganz viel machen.
You can regenerate bandwidth. That's the big thing people need to know.
Das Große, was die Leute mal mitkriegen müssen.
Great.
Super.
So with our therapy, we help if it's acute, but then the patients get homework, which they should also do at home.
Die Patienten bekommen Hausaufgabenliste, was sie da auch alles zu Hause machen sollen.
Infrared, for example, helps a lot. Tipping table.
What was that? Oh, tipping table, so that you sort of hang out a bit.
Kipptisch.
Genau,
Kipptisch.
Table.
Okay. Also, dass man sozusagen so ein bisschen sich aushängt.
Exactly. I recommend that for the patients before they go to sleep, 5 to 10 minutes every evening, so that the intervertebral disc pulls itself out, so there is more water, more fluid in the intervertebral disc, and that's how it regenerates.
Die Bandscheibe zieht sich aus, also dann kommt mehr Wasser, mehr Flüssigkeit in die Bandscheibe und so über die regeneriert sie auch.
That's very helpful.
Hilfreich.
Great. Thank you very much for the input, and it's nice that you have such an extension and that you are working on the subject of the moving apparatus even more.
Im Thema Bewegungsapparat arbeitet bei euch.
Yes, we have now established a medical line in the hospital, one would say wing, which we have now really established, and we have incredible success at the Sonnenberg Biomedicine Center in Schwelbrunn, in beautiful Switzerland.
Und unglaublich gute Erfolge im BioMed Zentrum Sonnenberg in Schwelbrunn, in der schönen Schweiz.
Thank you both, and see you soon.
Thank you.
Dear viewers, it's wonderful that there are solutions, especially in the case of intervertebral discs, and maybe one or the other tip was also there for you. Thank you for watching. See you soon. Bye.